What if we could use light to heal the brain, the body, and the mind? We have already been using red light therapy for the past 100 years, helping to improve cellular health and inflammation control. Red light therapy spans a vast range of meanings. We could be utilizing red light therapy devices that are LED based, such as like a red light wrap. We could be utilizing things that are transcranial, like a Vielight neuro unit that's pushing infrared light and near infrared light into the brain for specific purposes, like increasing energy into what's called the default mode network. We could be utilizing red light and specific frequencies in intranasal applications, or even blue light therapy. This particular device, we have a 470 wavelength, which is just blue light, and we have an 810 wavelength, which is in near infrared. Putting these intranasally can help fuel the blood that's going into the brain in the sinus passages and in these capillary beds up in the frontal sinus. We can also help to clear any nasal infections, sinus infections, up to improve blood flow up to the lower part of our frontal lobe, or what's called the orbitofrontal or orbital-prefrontal cortex, which would help boost focus, mood regulation, and even cognition. We also have the class 4 laser therapies, which can be more orthopedic and musculoskeletal in nature, where we are shining this red light directly onto a joint or a muscle group to help to improve the function of that tissue. This flickering of the light is a pulsating red light. It's fusing multiple different wavelengths together to provide a complex and comprehensive therapeutic application and dosage to the patient. We also have a full body red light therapy panel that you lay underneath that addresses full body blood flow regulation, cellular improvements, ATP regulation, and skin collagen elasticity, all the anti-aging health benefits that make you look pretty. But it also makes your cells fire and makes your cells perform better so that you have better energy, better health, better longevity overall, and you look good doing it. Red light therapy, or photobiomodulation, means using photons, light, to modulate your biology, photobiomodulation. How we do that in specific wavelengths mean different things in the body. We'll not get into that. However, what we're trying to do is ultimately improve your cellular health and increase your mitochondrial energy production while also having the blood flow and inflammatory controls. That's kind of the basis of all red light, but each wavelength provides a very different output and outcome for the user, and not all wavelengths are the same, and not all red light products are the same. Very important to understand the differences and the dosages, especially in red light. You can underdose and not have an effect, or you can overdose and have negative effects. And so red light, we really want to be in this Goldilocks zone of not overusing it, but not also underutilizing it. With devices like a fringe wrap that is more of an at-home use that's providing a low level or low output or wattage output. Having this lower wattage output usually is safer and easier for long-term usage and a little harder to overutilize. However, if you're using something like this and you're having maybe some skin irritation or your muscles aren't feeling the response that you're hoping for, try to use less actually. And if that doesn't work, go back, maybe use a little more, but do less first and see how you responded to that. With something like a transcranial photobiomodulation device, we're using different wavelengths to address specific areas of the brain to improve cognitive regulation, brain balancing, what's called your default mode network, which is your regulated brain state at a resting state. Or intranasal applications, very specific for the bottom of the brain, your sinuses, etc., at helping to heal any infections, helping to improve blood flow to the base of that brain for better cognitive thinking. These two units, Vielight specifically, is the only brand of transcranial red light wearables that actually penetrate the skull. Anything else that might look like a helmet is supplying too low of a level of an LED that doesn't have enough strength to penetrate the skull. So if you want to use something like this, or something that's an at-home lower level unit, what you're going to do is instead of placing this on your scalp because it's not going to penetrate anything, you're going to place this on the front of your neck and then also on the back of your neck, hitting these two areas, maybe even on your face, with your eyes closed, so that you can have what's called a blood illumination effect, where you are using red light therapy to stimulate the blood that then is going into the brain, not necessarily needing the power or the joule density to penetrate through the skull. However, you can still access this, just not through, you can still access the brain with this red light, along with all your body parts and your joints and your achiness and your soreness and your pain. But to utilize this for the brain, place it over these big arteries that go up to the brain instead of trying to go through the skull. Red light or photobiomodulation targets the mitochondria. It helps you increase what's called ATP production, which is your body's dollar bill of energy currency. We burn this for all of our cellular reactions, for all of our cognitive reactions, for all of our healing aspects. ATP is needed for every single energy burn in your body. Red light helps to turn that wheel and create ATP seemingly out of nothing. What it's doing is creating a friction where these photons are passing through your cells and bumping against your mitochondria and your hydrogen atoms to help to create this ATP churn or this increase in activity. This helps to improve healing, reduce pain, improve microcirculation and blood flow, help to reduce oxidative stress, and overall feel better and perform well. There's also evidence and research that supports improving muscular endurance using red light before you exercise, which would increase your cardiovascular endurance, your muscular capacity. Whether you are a marathon runner, bodybuilder, you can work out harder, longer, even if you're just Joe Schmo like me and you like to work out or you like to go out, play in the mountains. Having longer endurance, having a better conditioning, having stronger muscles leads to a more joyful time out in these activities, better longevity, better vitality. We use red light therapy for a whole host of things, from brain health to joint health to gut healing to mental health regulation, all the way to performance and muscular recovery for athletes to longevity seekers through cellular health optimization. Red light can be used on the body, on the nervous system, on the GI system. It can help to improve your mental health. It can help to improve your sleep. It can help to improve your energy. Red light therapy is a whole host of things. All these fancy devices are great. However, really where we get our red light from is the sun. Getting outside and doing the things that you love, getting sun exposure is the best way to help your cells on a day-to-day basis, while using some of these devices to support you on a more intermittent basis and maybe on very specific applications for specific things. If you are an athlete, maybe getting a red light or finding chiro or PT that utilizes laser, or if you're a brain health seeker or an executive or a performance junkie, or you're recovering from a concussion or a TBI, some of these transcranial devices, wearables, might be great options for you at home. We also use this laser here. We can turn the wattage down to a 3B laser level and use transcranial applications to upregulate various areas of the brain itself and have changes in brain balance, have changes in brain activity, and thus then emotional regulation or behavioral changes, cognitive, brain fog, all the way to inflammatory post-concussion healing. So different wavelengths, we have 630 to 680. This is very surface level stuff. This is supplying the skin, this is collagen production, this is that age glow, this is that warmth that you kind of feel on the skin level. You feel this really well when you feel the sun on your skin, but that 630 to 680 isn't a very deep penetrating wavelength, and it's not going to give you very deep muscle or joint pain relief or really so much the energy production in the cells, just having a skin surface level effect. Collagen production, beautify, anti-aging, anti-wrinkles, things like that. It could also be really good for wound healing if you do have like a scrape or burn or skin infection or something like that. This can be really beneficial too. That upper end of 630 to 680, that 680 does have bleeds into mitochondrial benefits and upregulating that cytochrome C oxidase, or how we actually produce more ATP or more ATP at that cellular level. However, again, the depth of penetration just isn't strong enough. So 600s, it typically aren't used very much Our device here is producing 650, kind of a little more of a regulator. Let me see where the light is because it's a very bright red light. Once you get to 810 and above, it's very difficult to see. It's near infrared, it's outside of our visible spectrum as humans. 810 to 830 nanometers is for brain health and inflammation, and for joint and muscle health. 810 is one of the best well-rounded wavelengths out there for all kinds of applications. Most class 3B lasers or units that only produce one wavelength usually hang out in this 810. Has a really great optimal depth penetration. It's also addressing majority of what we want in red light in the mitochondrial enhancements and energy production advancements, kind of accelerations. This is also great for oxygenation and blood flow regulation, building denser capillary beds within these tissues so that we can get better oxygenation and better nutrients. Photon passing through and creating a friction or a heat deep inside the tissues is extremely pain relieving. Now, anybody who has some knee pain or shoulder pain or elbow pain or ankle pain that have had red light or laser therapy specifically for that know the benefits that it produces. These things aren't just surface level healing band-aid things. These things are deep rooted energy production to that tissue so it can heal, so it can get ahead of whatever injury you're dealing with, and you can actually rehab it properly and do the work needed with red light as a support system so that you can do the exercises to actually do the healing. 850 nanometers to about 910 is really deep penetration. Our laser here goes from 810 to 915 and then 980 and 1060. This laser here at 915, 910, we're looking at that deep penetration of all that 810, all of what 810 is almost so deep. Circulation enhancement, muscle recovery, inflammation control, blood flow regulation, energy production, mitochondrial enhancements, DNA production. This is maybe better suited for brain penetration as well. Our Vielight units push 810 and 915 for the best penetration in the skull and the best suited for these neurons as well. 910 to 1060 is the holy grail for pain and inflammation. This is extremely deep penetrating. This is fantastic for energy production. This can penetrate deep into bones and joints and nerves that are right up against those bones. Think disc herniations, think big quad injuries, think rotator cuff injuries, think hip glute injuries. We want really deep penetration in these areas so that we can address all the layers of the tissue properly. 815 to 1060 really helps us do that. So, when you're choosing a red light or you're looking for a place that does red light, pay attention to what wavelengths they use because not all wavelengths are created the same. Little quick summary, that 630 to 660 is going to be super shallow and give you a lot of that collagen production, a lot of the skin anti-aging, anti-wrinkle effects. Once we get closer to that 680, we're getting a little bit deeper. We're getting a little mitochondrial benefits, a little extra pain relief, maybe a little deeper collagen production for these structural tissues. When we're looking at 810 to 830, this is a little bit deeper. This is looking for muscles, joints, brain health. This is pain and inflammation. This is mitochondrial enhancements and energy production. When we look at 850, this is circulation, blood flow regulation, and more energy enhancement. When we're looking at 915 north to 1060 nanometers, that is deep penetrating pain relief and inflammatory control for neuromuscular structures. If you are dealing with orthopedic injuries or repetitive injuries, you're an athlete, you play out in the mountains, maybe you have chronic headaches, maybe you have chronic fatigue, maybe you're recovering from a concussion, maybe you just want to optimize your brain health, maybe you are dealing with some brain fog or anxiety, maybe you just want that extra support, you're an executive, you're a high performer, you want that sharper cognition. Red light photobiomodulation could be a great answer for you. Chat with your local experts, find a unit that fits your needs and what you're looking for. If you have any questions, comment below. I'd be happy to point you in the right directions. Happy healing with red light, happy healing with light as a whole. Get out, enjoy some free red light out in the sun. Overall, red light therapy is information, is energy, is healing, is blood flow regulation for your tissues, whatever we're trying to shine them on, whatever we're trying to have an effect for. If you use it correctly, you can really change how your brain, your body, and your mind heal. Reach out to us below. Give us a call at the clinic if you want more information on red light or laser therapy and how it might be able to benefit you.